It is that time of year. Spring allergies are here. We're talking about congestion, runny nose, watery eyes, what to do and how to know if it's allergies or something else. So Dr. Evelyn Lomazny with Cone Health Allergy and Asthma Center of North Carolina is here to help us tackle those questions and much more. All right, so let's just start with the basics here, right? How does somebody know if what they're dealing with is allergies or something else like cold, flu, or COVID?
That is a great question. I usually tell my patients that allergies are almost never associated with a fever. So if you're having fevers, I would think viral or bacteria infection first rather than allergies. And secondly, allergies tend to be associated with a lot of itch symptoms, itchy throat, itchy eyes, itchy nose. Now you can get this in upper respiratory infections, but if you're having those symptoms without a fever, I would think more allergies.
Okay, let's talk about maybe some symptoms that could be like red flags for seeking medical attention, and then kind of tell me where the symptoms and where do we seek the medical attention?
Sure. If you're having fevers, high fevers associated with any kind of respiratory infection that's been going on for more than 3 days or so, I would say that needs to seek medical care. I would start with your primary care, but if you're having shortness of breath associated with that, then you start thinking of more urgent evaluation. From an allergy standpoint, we certainly have our asthmatics, and if they're having wheezing associated with their allergy flares, you definitely want to get into your primary care, or if you're established with a pulmonologist or an allergist, to seek them out to get better control.
Okay, when you feel bad, the last thing you want to do is go out and look for medicine. So are there like some home remedies or things that we can do to provide relief and ease of the allergy symptoms before we go to the store?
Sure, that's a great question, a difficult one. I think the first mainstay treatment of allergies is prevention and starting there. So things like doing the avoidance measures for pollen, showering after you come in from the outside, keeping your windows closed in your car, in your home, are all things that you can reduce the pollen exposure you're having. After that, you're probably looking at medications to help alleviate your symptoms, but you can certainly reduce your exposure overall.
Okay, well then let's get right to the medications then, if that's what's going to help. So what over-the-counter medications do you recommend for managing your allergy symptoms, and then how quickly do they actually work?
Sure, most of these medications work fairly quickly. You should see relief within a day or so of starting them. Sometimes they do take a couple days. We always recommend trying a long-acting antihistamine. Specifically, look for the ones that don't make you drowsy and are marketed for that. And then I think people really underutilize nose sprays, especially the steroid nose sprays. I will say when you start those, they can take up to a week to really see a benefit. So those are ones you want to give a longer try for.
Okay, and when we're talking about these over-the-counter like allergy medicines that you're talking about, the 24-hour antihistamines and stuff, how long should we take them? And do we take them until symptoms end, or do we take them all allergy season long?
So that's a great question, and that's one I think an allergist can help you out with, especially once we figure out what your known triggers are. It kind of depends. If you're a tree pollen patient, you might only need it in the early spring. But if you're allergic to trees and grass and weeds, you're really looking almost March through October that you're going to have symptoms. So I think that's a very personal decision. I do recommend my patients to tend to be more proactive with medications, especially if they're pretty symptomatic. A lot of people sneeze or wheeze and then they take medications, but if they can take them to help prevent those symptoms, they might feel better overall.
Sure, I'm sure. All right, so can your body build up a tolerance to allergy medicine like it can do to other things?
That's a great question. I would say the research says no, that there is no tolerance you build up to antihistamines. However, anecdotally, I hear this a lot. So if a patient feels like their antihistamine isn't working, I say, hey, let's try another one and see if that makes a difference.
Okay, so not supposed to do that, build up those, but if you're finding it doesn't work, just do something else.
Yeah, there's no harm in trying something different.
Okay, any concern with folks over the age of 65 taking antihistamines for their allergies?
This is another great question. We definitely don't recommend any of the antihistamines that can make patients drowsy, and those tend to be the older ones. The newer ones that are on the market tend to have less of an effect. Lastly, I would consider any drug can react and interact with any other drug. So if you have an older patient who's on lots of medications, any over-the-counter you're going to buy, I recommend talking about it with your primary care doc to make sure we're not missing something that could happen.
All right, and so a lot of these are all over-the-counter things. At what point should you actually contact your provider?
I would think if you're taking a daily antihistamine plus minus a daily nose spray and it's not working for you, I would definitely reach out to make sure we're not missing something else. I would also consider, I tell every patient can come see an allergist if they want to reduce their lifetime use of medication, because we definitely have more tools in our toolbox than are just over the counters.
Okay, all right. We're going to take a quick break. We're going to come back and be talking about more allergy stuff so we can stop the sneezing, wheezing, and the itchy eyes. That's coming up.